Hello, everyone, and welcome to another edition of 2-Minute Emergency. I am your host, Dr. Leslie, board-certified emergency physician, best-selling author, international speaker, and professional photographer. And I come to you bringing you tips to help keep you healthy, safe, and out of the emergency department. So what is the topic for today? Today is sciatica. Now, lots of people have heard about sciatica. Not often does everyone know what it is. So, sciatica is the pain induced by the nerve called the sciatic nerve, which travels from your back and extends down your leg. And that pain can be sharp pain, it can be dull pain, it can be more like an electric shock feeling, it can be numbness, it can be tingling. So that's what we're talking about when we talk about sciatica. So sciatica is very common. Matter of fact, 3 million people have it every year. I've had it myself, so I know exactly what it feels like and how miserable you can be with it. So sciatica is more common as we get older. I won't say how old I am, but in people over the age of 40, and there's some other predisposing factors to it as well. There's obesity, diabetes, inactivity. All of those can cause or predispose you to having sciatica. So sciatica is most common if you have some people think about it as being a pinched nerve. Well, it is. The sciatic nerve is actually the largest nerve in the body, and it's approximately 2 centimeters in diameter. And what happens is it can be caused by a herniated disc. It can be caused when you have what's called spinal stenosis, which is a narrowing of the spinal canal itself. It can be caused by a bone spur, actually in the spine. It can also be caused, but much less likely, by having a tumor in the spine. And the sciatic nerve is composed of multiple nerves that all coalesce together to form the sciatic nerve. So that is from the lumbar spine L3, 4, 5, and into the sciatic or the sacral area of the spine as well. So all of those coalesce and they form the sciatic nerve. So if it's all that common, is it really dangerous? Most cases, no. In most cases, it's self-limiting. Unfortunately, can last for several weeks. 6 to 8 weeks is actually the average, and it can last a lot longer. People often seek emergency care because it is so painful. And generally we treat it if you've already tried the over-the-counter things such as acetaminophen, ibuprofen, heating, hot water bottles, that sort of thing. If that doesn't work, then you come in and see us. And often we give you steroids to help alleviate that inflammation. But it can also be an emergency. So that is an emergency when you have changes such as weakness in the leg. We're not just talking about pain, we're talking about actual weakness in the leg. When you have any changes in your bowel or bladder function and you don't even feel like you have to go and all of a sudden you have an accident, that is something that's an emergency because that's to the point where you need a surgical decompression of that area. So it's not just the pain, but if you have those extra symptoms. So sciatica, very common. Some of the things you can do to avoid it. Well, it can't be avoided entirely, but activity, making sure you stay active makes a huge difference. It's more common in people who are sedentary, sitting a lot of times, people who drive for long periods of time. It's also common in people who, as I said, are obese. So you want to make sure that you are on a proper diet to get rid of that extra weight. You also want to make sure that you're lifting things carefully because, as I said, they can be caused by herniated discs. So just learning how to lift properly can make all the difference in the world. You want to lift with your legs and not your back. Other people that are more common or more prone to get this are people who do a lot of lifting and also a lot of twisting movements. So say you're someone who loads things onto a truck, for example, and so you're constantly turning from one side to the other as you're picking things up and putting things down. that can also predispose because it causes such increased wear on the spine itself. So all of those are risk factors. One of the things you can do in addition is, because it's uncomfortable no matter what you do, but to relieve a little bit of those symptoms, walking, believe it or not, makes many people feel better. One of the other things that people do is, if you're laying, because it's worse at night, trust me, it is definitely worse at night, is sleeping with a pillow underneath your knees. So your knees are actually elevated. That can also help. So I hope you learned a little bit about what sciatica is and what it isn't, and how it can be treated and when it is an emergency. Once again, I am Dr. Leslie, board-certified emergency physician, best-selling author, international speaker, and I help teach you about different things that can be emergency conditions to help keep you safe, healthy, and out of the emergency department. Until next time, take care, stay happy, and stay healthy.